Hello again, everybody. This is Craig Evans of Autism Hangout, and thank you for tuning into this episode of Ask Dr. Tony. I'm going to bring Dr. Tony up here in a few minutes, but first I wanted to talk to you about how we go about selecting the questions we do for these Ask Dr. Tony sessions. As you can appreciate, between our sessions we get literally hundreds, 200 to 300 questions to address with Dr. Tony. Many of them, between 60 and 65% of them, have to do with issues of, I think I'm on the spectrum, I think a family member is on the spectrum. How do I go about getting diagnosed? What's in a diagnosis? And what services are available to me? Dr. Tony and I have addressed this extensively in past issues of Ask Dr. Tony, and these answers are also available in his books. So if there's one available in a local library, you might want to check it out and read it, or you can buy these online. If you fall within that percentage category, find a local autism association and become friends with them. They will be the best ones to offer you the names of professionals that can help diagnose you, as well as the services that would be available to you in that area. What we'll be addressing in this session, as all the sessions from this point on, are either new adaptive behaviors that will help people on the spectrum get along better in life, or new resources available to help people on the spectrum and their families adapt to living in an NT world. Thank you for watching today. I hope you find this content helpful. We'll bring as much of this to you as we can find. Hello again, everybody. This is Craig Evans of Autism Hangout, and thank you for tuning into this episode of the Ask Dr. Tony series, where Dr. Tony Attwood answers your questions about autism. Hello, Dr. T. It's good to see you.
Hi, Craig. Good to see you and hear you again.
I have to put this up front that we continue to get so many questions, and thank you people for writing in, but there's only so much time, so we have to be very selective about the questions that we ask. So, are you ready to address this episode's roster, Dr. T?
Okay, let's roll.
Okay, here we go. The first one is in the category of personal management issues. Do Aspies need to take meds for anxiety and depression? My 18-year-old Aspie son is currently in a residential drug treatment center. He began self-medicating about 2 years ago, first with alcohol, then he experimented with heroin and opioids, and finally now he's fixated on what seems to be Xanax. I never understood until recently that his anxiety, depression, and panic attacks were likely caused by his stress over being different and not fitting in. He still believes that meds, prescribed or illegal, are the only way to deal with his anxiety. What's the best treatment plan for him to move on from drugs and accept himself?
What a very poignant question. The first part is, do Aspies need to take meds for anxiety and depression? Often. Some can get by without, but often medication is prescribed specifically for anxiety and depression, usually the same types of medication. Now, he's in a residential drug treatment center. My own clinical experience and research suggests that about 1 in 4 in residential drug treatment centers have signs of autism, but often the treatment is designed for neurotypicals, not those with Asperger's syndrome. So it's involved with group sharing experiences and feelings and resonating with everyone and their problems. Often those with autism find it very difficult and that they're not often understood in drug treatment centers. Hopefully this center may understand autism, but I do think residential staff in alcohol and drug dependency services need training in autism. Now, next one. Heroin and opiates, unfortunately, are incredibly powerful in alleviating anxiety, but in particular, the racing, spiraling out of control thoughts. It slows them down very effectively, which is what the person is desperate to experience. Fixated on benzodiazepines, namely Xanax. Oh dear. Xanax is an incredibly powerful benzodiazepine. When you take it, you're almost drunk, but also you have major short-term memory problems. But it works to alleviate the anxiety. But benzodiazepines were only designed for short-term use, a matter of weeks or months, not to use indefinitely, year in and year out. So another component is stress over being different and not fitting in. So this needs to be addressed in the residential treatment, because otherwise he's going to go back to the same problem. It's really exploring, who are you? Who do you want to be? What are your qualities? But more importantly, other strategies for coping with anxiety. Now, for some, we've had success with yoga and meditation, but there are some whose spiraling out of control anxiety, meditation and mindfulness, I'm sorry, just does not work. So at this stage, I would recommend the possibility of Aspie mentor, someone with Asperger's syndrome who's shared the same problems and come through it. So it's talking to the residential treatment center. Who do they know that has Asperger's, or near enough? And maybe they will be able to talk Aspergerese with him and be able to be a mentor far more effective than any medication or neurotypical therapy. That's my reply.
The next is dealing with change. Do you have any suggestions for autism acceleration? And this is a whole new term to me, Dr. T. Autism acceleration, which is the struggle with the need to complete tasks despite wanting to task switch. I work with a very successful adult who has Asperger's, and she would like guidance around task switching. She gets into what she calls a time sink, and she spends hours doing a task until she falls asleep or it's completed. She'll ignore hunger or the need to use the bathroom. Now, she is a physician and she does well at work because the schedule is set for her, or urgent issues come up and she can motivate herself because of the urgency. We have talked about chunking activities into manageable time expectations or steps. We've also talked about using a timer or reframing some of her self-talk when she doesn't accomplish her goal of sticking to a time limit. And we've also discussed journaling and data tracking when things do go well so that she can look for patterns. Any suggestions on dealing with autism acceleration would be appreciated.
Well, first of all, to the author of this, well done for the suggestion that you've had, that you need sometimes an external prompt to stop what you're doing. That is either a timer that goes off or a colleague that very gently but very assertively says, whoa, you need to take a break, and to accept that. But from the description, it is an aspect of autism of having what we call a one-track mind, and you must have closure and finish the activity before you can recalibrate your mind to a new activity. However, this seems to have gone beyond that to almost be an obsession, and she's seeking the reward of completion. Yes, I know that. But it has now become so compulsive that it, to me, suggests high levels of anxiety. So she really does need treatment for anxiety to reduce the motivation for the compulsion and closure. So if I was going to add anything to it, what you're doing is great, is she needs treatment for anxiety.
Very good. Next is about self-esteem, self-identity, and faking it. Hello, I'm a 35-year-old female who was diagnosed with Asperger's 2 years ago after the diagnosis of my oldest son. And as much as the diagnosis was a revelation to me, the more I learned about the social mask that I've been putting on for years and how it's negatively affected me, the more I want to discard it. My problem is that I do not know what lies beneath, so to speak. How do I go about finding out my real identity?
What a lovely question. I think take the mask off slowly with those people you know and trust. Say to them that you have those characteristics and your personality may change, and you're going to be playing with the experience of the real self, but with people who can give you feedback. Now, the chances are they will say, wow, that's you, that's fine. But other people may find that difficult to understand. So it's creating with them an explanation for those characteristics that other people may find confusing or abrasive. For example, I'm the sort of person who talks and talks about horses. I'm not very good at reading This is boring signals. If I'm boring you, please stop me. I would appreciate it. So it's finding those aspects behind the mask that are confusing to other people and having a way of explaining it to them so they have the aha moment. That's okay. And I do strongly encourage you to take off the mask, because the alternative is the risk of depression. And in terms of real identity, you need guidance and positive feedback from those that you trust to be able to be more your natural self. As your confidence builds in testing situations, just of short duration, you can try being true to your real self. So, yes, please, but do it gradually.
I want to add one thing, that because between Asperger's and NTs, vulnerability is always very, very tough. So when you're trying to find yourself, make sure that you're dealing with somebody that you know and love and trust, and they know and love and trust you, because that's how vulnerability is rewarded. You'll grow.
Yep.
Next is intimacy, dating, sex, and marriage. Hi, Dr. Tony. I'm a truly loving and attractive 41-year-old female that was diagnosed 3 years ago. I've always struggled to find, stay, and recover from romantic relationships. I love your advice on these 3 relationship stages so I can push through my current limitations and I can create a lasting relationship. So she starts here with find. I seem to attract rather lonely men, 15 to 20 years older than me. Age-appropriate men don't seem interested. Now I look younger than I am, and I get scared by obvious sexual interest for fear that I'm being preyed upon. I wonder if I'm missing some of the more subtle signs when somebody likes me. Next is stay. I put so much energy into a relationship and am very accommodating to the other person. However, when small issues come up, I often struggle to deal with them. I'll increasingly get stressed and emotional, but I hide it out of shame. I eventually have a huge meltdown, and I end things. And lastly, here is her category of recover. Once the meltdown has passed, rumination sets in. Initially, I tell myself that my actions and intuition were correct as a way of self-soothing. But then I start doubting myself and I regret my actions, and it takes me years to move on from the upset and rumination to a place of acceptance. Please help.
Indeed, what a challenge there. So this is someone who's very keen on a relationship, but hasn't really found a relationship that lasts some time. Now, obviously, this lady is attractive to some people, but may not be good at character judgments. Really, I would hope that she can find someone, possibly a neurotypical, who is a good character guide to check people out. Usually what's occurring with neurotypicals is they will go out in a group and have lots of friends, and a lot of the gossip between them is talking about who they fancy. What do you think of them? Do you think they're okay? Well, I'll meet them. I'll check them out for you. Oh, love is blind. You're missing out on some of the things that I see. So it's useful to have a second, third, or fourth opinion and progress slowly in the relationship. Now, sometimes the 15 to 20 years older than yourself, they would then be, if you're 40, perhaps into a more caring platonic relationship, which is a possibility. So there's something that is attractive to you. What matters is not necessarily the birth certificate, but the quality of relationship. And that's where you need some guidance. Now, next part is, unfortunately, small issues coming up, which you hide. Please don't. Part of a good relationship is the ability to repair, compromise. And so in many ways, what we're looking for there is, when you are with that person, to be open and honest. This really bugs me. This irritates me, but we're going to have to work on it together to overcome it. That's a sign of a good relationship, not to hide it. Now, there are certain things that that person needs to know about you. What are your buttons? What are the things that upsets you? And so on. So don't hide them out of shame. If it's a good relationship, you can trust each other to do that. Now, afterwards, unfortunately, self-doubt and regretting your actions, yes, that can be a problem, because it's almost a grief reaction. And each time you have a relationship, it dies. And I do think if you can, again, one of the themes this time is to progress slowly in many ways. But one is in the relationship so that it matures. But part of that is going to be, how do you cope with meltdowns? And a bit later on, we've got a particular topic on that. But go through with your partner what sets you off with a meltdown, and then say, this is what I'd like you to do and not do. Don't interrogate me. Don't use affection. Don't use compassion, those sorts of things. Don't get agitated or disappointed yourself. I need my personal space. So it's the do's and don'ts of when they occur, and say, look, don't take it personally. I tend to explode. I get it out of my system, cleanse it, I'm okay, then we'll start up again. So it's really explaining and recovering.
Also in the same category, how can I make dating easier? I'm a 20-year-old guy with Asperger's syndrome, and as a guy, I'm generally expected to make the first move. I'm also expected to do so with confidence. And this can be hard because I generally don't feel comfortable in most of the environments where I can ask a girls out, such as bars and clubs. And since I can't usually tell if someone is flirting with me, I can't make it easier for other people either. I don't know what to do.
Okay, another good question. First thing, please don't try and pick up people in clubs and bars. If you've got Asperger's, it's the worst environment to do it. It's noisy. It's incredibly and intensely social. You are going to be at your most vulnerable, confused, trying to read the signals with all the distractions and so on. Now, what I would suggest is if you're looking for a relationship, it needs to be where you're doing things together. It may be somebody at work that you get to know better. And it's really starting off with a friendship that improves into beyond friendship and a relationship. It's very hard to find a relationship that's going to be starting in a club or bar. It may be that you're a volunteer for something, helping injured animals, for example, or a cause. You're in your early 20s. You must have a cause, whether it be save the whale, politics, voting, whatever. I won't say in America your politics there, which are amazing. In other words, you need to meet people to talk, to express your personality and your abilities, and get to know people in that way, not picking up people, which is dangerous, inappropriate, and please stop doing that.
Mm-hmm. Very good advice. All right, one last question in the relationship category. How do I break up with an adult male Aspie? What is the most clear, compassionate, and kind way to let him know that I cannot continue in this relationship? I've been together for 4 years with this person, but during the last 2 years, the relationship got worse. And I now find myself unable to cope with loneliness, lack of affection, and not living together, although we are only 7 kilometers apart.
Okay, the first comment I have on that, been together for 4 years, so you really got to know each other. And part of the initial stage has been love and it's been great and so on. But gradually you get to know people and determine whether this is someone you want to live with. The implication is that you're planning on leaving, but the partner may not be. So what I would suggest you may do in an appropriate setting is to talk about the relationship, but with a large piece of paper in front of you. Autism and looking at me and talking is not the best way of finding out information or understanding your perspective. So on this large piece of paper, you have his perspective and 2 columns, positive and negative. So from his point of view, what are the positives of the relationship? Also, what are the negatives? But then go through your positives of the relationships and the negatives. And so logically, on balance, you can literally see why you are considering leaving. He needs to see it. When we understand, we say, I see what you mean, not I hear what you mean. So it's looking together at that piece of paper and discussing each of the positives and negatives so that he can literally see your perspective. Then say, I am seriously considering leaving the relationship. And then it's going through that on a logical basis to go through how he may cope without you. Mm-hmm. The difficulty is that you don't want guilt to cause you to stay. That's not a good reason to maintain the relationship. So he will also need to know your perspective to give a chance to explain his perspective and what's his life going to be like without you in it. So I think it's very brave to go ahead and do that, but that's what I would suggest.
Very good. Gender dysphoria. My son is 17. He was diagnosed with Asperger's at age 9 after many years of difficult social and peer interactions. He's an excellent, accomplished student, and he's now a senior in high school applying to top universities here in the United States. He announced at age 15 and a half, with no prior indication, that he is gender dysphoric and considers himself a transgender girl. This has been going on now for about 2 years. His dad and I believe, and frankly hope, that this is a temporary development stage as part of his ASD diagnosis. Can you offer any insight as to how long this transgender thought process may last for him? We're desperate to get our son back and do not buy into the current transgender trend.
This is not an isolated situation, and increasingly in my clinical work, I'm seeing males and females who are seriously considering and going through the process of changing gender. Now, first of all, he announced with no prior indication. He would probably have been thinking about this for some time before and then summoned up the courage to announce that. So it's been something that's going on in his mind for a while. Now, in my own clinical experience, there are those who, for a long time, have questioned their own gender and by changing gender have in fact been much happier. There are some that I've known since they were little children and they're now in their 20s. And by changing gender, they're the happiest I've ever known them in their lives, but not all. So for some, it has been a very good process. But what we've got to explore is the thought and intention to change gender to solve a problem? And it may be that there is a concern that if I became female, for example, I would have female qualities, I would have lots of friends, I would be very good at socializing, it would potentially cure my autism. And so in other words, there's a problem in his life that this appears to be a solution, and we want to explore that as to other potential solutions, and he has his choice. But another concern for me in autism is the concept of masculinity and femininity. And so, for example, for some males with Asperger's autism, they see masculinity in terms of macho, this is my age, James Bond, that type of character. And they say, I'm not like James Bond, I'm not macho, but I'm kind, I'm nice, I care, I love animals. But that's a girl thing. Well, maybe I am a girl because I identify more with femininity. And the same with some of the girls who say, I enjoy boys, I'm a tomboy, they're very logical, I like mathematics, I get their jokes and so on. But I'm not the quintessential fashion-orientated feminine girl. So what I want to try and explore for those with autism is at school or at home, the concept of gender. And that you can have a man with some female qualities that become very good as a parent. Or you can be a girl, a woman, and you have that, I'm interested in sports and those sorts of things. And that's okay. It's not a black and white. They're not either totally 100% male or 100% female. And I think that needs to be explored. But I will say this, and this is very important. Please support him. Because when I look at the successful outcome, whether they have transition or not, what has been an essential ingredient of happy outcome is parental support on the journey. Now, he probably knows very clearly that you don't support his suggestion or decision, but you need to go with him, not against him, because as parents, he will need your love and support on that journey, wherever it may go. It's accepting him, not necessarily the gender he is considering. Okay.
That's profound. All right, on to meltdowns. Our 45-year-old daughter is a psychiatric nurse who I'm now pretty sure has ASD. We're no longer communicating with each other. She has always refused to seek help, saying it was us who needed to see a psychologist. So I did. Fortunately, she is now working and she's in a relationship, about 17 years now. They have no children. She wants to draw up a contract about what to do at funerals, though my husband and myself are still fit and healthy. But the problem is meltdowns. How do we tackle the subject?
Indeed, and there's something about funerals that needs clarification. Funerals are often reviewing someone's life and evaluating that life. So there's just something about that, or whether there has been bad experiences with funerals or the family have particular issues. That needs to be explored personally between them. But the issue for general consumption is in terms of meltdowns. Unfortunately, many with autism are not aware of the internal signals of meltdown on its way. And so sometimes it's other people who sense you're about to lose it, where the person, no, I'm not, I'm fine. But very clearly that's the case. So when the person is calm, I would recommend on a large piece of paper drawing a thermometer, and to go through on the left-hand side of the thermometer, what are the mannerisms, the actions, the thoughts, the behaviors, the situations, all the things that indicate meltdowns on its way. I do also strongly recommend use of a Fitbit or equivalent, which measures heart rate. So in other words, when she's getting upset, the Fitbit will indicate your heart rate is increasing. No, it's not. I'm okay. Have a look. Oh, it is 135. Yes, because your resting heart rate 70. Oh, I didn't notice that. You need to do something about it. There are some that will actually vibrate if you reach a certain level. Prevention is better than cure. So also in going through that list of circumstances and behaviors, thoughts, actions that indicate meltdown, on the other side of the thermometer is what to do at each of the levels of agitation, and having a plan that should one occur of what to do. As I said earlier in this conversation, it's do's and don'ts. When I have a meltdown, in other words, leave me alone, I'll get over it, don't interrogate me, don't get emotional, negative or positive. I need to have a tranquility of seclusion in a refuge where I can go. Sometimes schools will need somewhere they can go to have that, shall we say, opportunity to calm down on their own, because people often cause the meltdown, but they will deepen it and prolong it if they're not careful. So when the person has a meltdown, it is very important to use a strategy I call a GPS. You probably have those in cars in the United States. You may have a different term. But if you don't do what the GPS suggests, turn left, and you carry on, it does not say, what the do you think you're doing? I just asked you to turn left. You never turn left. You never listen to what I say, which only makes it worse. What the GPS says is, at the next junction, turn left. It does not tell you what you've done wrong. I want people to take on that approach, that when somebody's made a mistake or it's going wrong, don't judge, criticize, because you're going to make the person worse. It's just, what can you do to alleviate the situation? So it's going through the do's and don'ts in that situation to try and minimize the depth and duration. Once they've occurred, that's it. Sorry, it's happened. You try and prevent it by seeing the build-up. I need to take a break. I need to calm down, take a deep breath, use a bit of yoga, meditation, or distraction, or whatever it is that you do to actually prevent them occurring. Afterwards, it's the art of apology and restoring the rapport and relationship. Otherwise, resentment builds up over years.
The next is anxiety. Should you make your 12-year-old son stay in a class when he's coming home mentally distressed every day, more distressed than usual? I want him to homeschool, but he won't. Do you have any advice?
First of all, this 12-year-old is incredibly brave and determined. And I am amazed at some with autism who continue going to school. It's often only family that see this when he comes home from school, because often the person suppresses it at school and is desperate to fit in and to be successful and saying, no, I must do it, I must keep going, I must find an answer. But the stress and strain is becoming great. So there's a balance here between his determination, I'm going to succeed, and parents saying, actually, you're falling apart. What we need to find out is what's happening at school that's causing such stress. Now, is it social? Is it bullying and teasing? Is it loneliness? Is it lack of friends? Is it the teachers don't understand me? Are there elements of too many people, too many crowds, and so on? So what are the social dimensions that cause him stress? The next one is academic. How well is he doing with the curriculum? Does he have any particular learning difficulties? Does he have a problem with a style of a particular teacher? All those academic components are going to be important, because if you're not good socially and you're not good at sport, the only thing you've got is your intellect. And if that's not successful, then you have major problems. So are there any learning issues that the school need to be aware of? The next one is sensory. Are there aspects of the sensory environment that are overwhelming? And I'm afraid school is an environment of great anxiety because of change and all those sorts of components. So he's obviously not communicating effectively at school. His stress, that needs to be recognized and go through strategies to help him there. But he's very brave, because it's almost like sending him off every morning to a war zone where he's determined to finish the campaign and be victorious and be successful. But at what cost? And that's what concerns me. So he's obviously not ready for homeschooling. I think that may be something down the track. The first stage I would go through is detailed conversation with the school on the dimensions of social, academic, emotional, and sensory.
Very good. My daughter has been diagnosed with ASD, Asperger's. This year she began primary school and has been having extreme trouble with being in group situations. Her anxiety levels mean she can't be in a normal classroom. So she spends her time in the special education classroom. We live in Japan and she attends a Japanese primary school. Recently, the main doctor that we see has suggested that she's reached the age where we can consider trying medication for her anxiety. He didn't say it was necessary, and he was happy with her progress, but nonetheless, he said it was an option if we want. The two medications that he suggested are risperidone and aripiprazole. Do they help? If so, how? Are there any side effects? And what is your opinion of these?
Okay, first of all, she has Asperger's, and she will probably find the classroom overwhelming, especially if she's very young and her peer group are going to be somewhat chaotic, and there's going to be a lot of social, sensory, all sorts of issues that are occurring. And it seems that she's chosen to withdraw into a quieter, probably more structured and supportive and better ratio of kids to staff classroom. So what I'd be looking for here is not medication at this stage, but environmental modification. It's actually seeing the classroom through her eyes, ears, olfactory, sensory system, and her thinking. And what she will need is, I would call it, a retreat or sanctuary in her classroom. Now, this may be a little corner that they've made by shifting some furniture. Some classes have actually used an actual tent for the child to go into. But every so often, she will need a sanctuary to recover and focus. In that sanctuary, she can look at books, she can play constructively, but by being away from too much social and sensory, she may then be able to reduce her anxiety and better focus with the schoolwork. So I think what she's saying is she's overloaded. Now, the next thing is medication. Now, if she's anxious, the medications suggested are technically antipsychotics and may not be the first choice for dealing with anxiety, because they're very powerful. They're great for schizophrenia, but she doesn't have schizophrenia. She's only a primary school. normally we would use what's called the SSRIs, Prozac, Zoloft, and so on. But be careful, for those with autism, as I find clinically and research suggests, about half those who start taking such medication, it has the opposite effect. It gives you agitation and activation, which is not relaxation and better. You won't know till you try it. But a low dosage of medication to treat anxiety, like an SSRI, may be the first choice of medication if you're going to use it, rather than the heavy dose of an antipsychotic, which can give you a bit of a mental fog. So the doctor is right, medication may help, but I would see if environmental modification may remove the need for medication.
Mm-hmm. Very good. This category is living with autism. There seems to be an increase of people being on the spectrum. Would that be because diagnosis is better, or is the condition actually increasing? Is there a genetic or familial component with this?
Yeah, there are more people being diagnosed, and we're better at diagnosing it. We're broadening the goalposts in a way with Asperger's, high-functioning autism, whatever term we happen to use. So we realize autism is not exclusively those who have high support needs, major problems with communication and learning. It includes people who are university professors and so on. But what we're finding now, as we're more accurate in identifying the features, are children who have the signs but not the impairment. They have the characteristics, but they're doing pretty well. So when you do the research, yes, all those signs are there, the pattern is there, but they're doing really well. They don't need a psychologist, a psychiatrist. They don't need special education and things like that. They need a bit of verbal guidance and so on. But of course, statistically, they're added to the data because they have the characteristics. Now, is it actually increasing? My opinion is that it is, but only marginally. I've been working in this area for over 40 years. And I can remember there are kids that we would not have missed 40 years ago. I'm sorry, we wouldn't have missed them. And there's more of those such children. So there is something about our modern society that may marginally be increasing, that range from having children later in life to all sorts of environmental pregnancy situations. Now, genetics, yes, in about half of cases. But what we look there for is not necessarily that it runs in a family, but maybe genetic material that's a one-off, like Down syndrome. So those are the components of genetics. But in about half the cases, it may be an environmental explanation. And it's very difficult at this stage to determine why a particular person has autism, unless, for example, they have a parent and one or two siblings on the spectrum. Then the chances are, common sense will tell you, it's probably genetic for that person. But then you can get someone else. No. Both parents scan, first of all, their partner's family history, then their own, and say, nah, not on your side, not on my side. It's just happened, and that's the way it is.
Mm-hmm. Dr. T, do you recommend getting a specially trained dog for a 6-year-old boy with autism? And this brings up the whole subject matter of what are the positives of a companion animal for somebody on the spectrum?
Do I recommend? Absolutely. It really does depend on matching two personalities. It's the personality of the 6-year-old and the personality of the dog. Dogs are usually better at this than cats, but I'll give you an illustration. We have our, what we call moving to manhood group for young teenagers with autism. And we were going through anger management and so on. And one of the guys said, yeah, when I'm feeling angry, my cat comes up to me. She moves in and out of my legs, and that soothes and calms me. I thought that was brilliant. And often the dog will have an ability, sometimes even better than a parent and the person with autism, to sense you're losing it. And it's then going through that process. I also saw someone this week who has classic autism, no speech, 5 years old. He's a runner. He just goes. and he's lost and they don't know where he is. And they said, should we get a dog for him? And I said, yes, but also train the dog to find him. So you can start off with little games of finding the boy, so that if he does escape and runs off, you say to the dog, find him, and the dog will know where he's walked off to far better than any other person or tracker. So that's another value of it. Also, sometimes dogs can be trained to identify epilepsy on the way, but I would see as a companion and emotional support. And that companion accepts you, wants to be with you, is delighted with your company, and is everything that a good friend should be. So I would say yes.
Can living with high-functioning autism cause complex PTSD? Have there been any studies on the co-occurrence of these two conditions?
There are starting to be. And what's interesting is that I'm identifying, as I go through the developmental history of some of the adults that I see, PTSD. Post-traumatic stress or shock disorder is a reference to what you've experienced. And many with autism have experienced quite traumatic events for a variety of reasons. But what counts is how you personally experience that event and your coping mechanisms. And for those with autism, their coping mechanisms with trauma may not be as effective as neurotypical. So it goes deeper, longer, and it is more likely to affect their current circumstances. Now, in trauma, we often find that one of the best solutions is a quality relationship. But for some with autism, a quality relationship as an adult may appear elusive, but for neurotypicals, it can be one of the most effective therapies. So, yes, there is an association because those with autism are easy victims of a range of abuse. They may have witnessed trauma too, but their way of understanding the motives of others, the intensity of the emotions, and not being able to have closure means clinically we need to develop greater expertise in this area.
Mm-hmm. Dr. Tony, lots of people write us with questions, but every now and then somebody will sail something in that is just stunning, I think, in its perspective. It's so encouraging. And clearly here I have a message from what we've called an Aspie mentor. I just want to read this. It's under Thriving with Autism. As an undiagnosed Aspie, the thing that I found most helpful over the years is being determined not to give up. I throw myself headlong into challenges such as going to a party alone, or facing someone who is critical, or sleeping with my PJs bunched up. I face these challenges for as long as I can handle them, and then I retreat to recover. Knowing that I have the out to regroup gives me strength to push through a bit further, and the sense of accomplishment that I feel is indescribable. And then I just focus on my strengths, which are attention to detail, being helpful, smelling trees as I walk past, and remembering that I'm not just different. I'm special. But in reading this is such a dear person. This is such an internally focused, strong person. I love it, people, when you send these things in, because it shows how much hope there is for all of us, NTs and Aspies alike.
Mm. My thoughts are, you are my hero. Psychologically, you're doing the best thing. Because psychologically, the worst thing to do is to run away from something.
Yeah.
But it's also knowing your limits and knowing that, okay, I've done my best. I can't win everything, but at least I tried for your own integrity and self-esteem. It means that gradually you will build up your inner strength, your self-esteem, self-identity, and achieve particular skills. You are the sort of person that I think could be a mentor for the younger ones because you've actually experienced it of what to do. I can talk about it, but I'm NT, I'm not Aspie. So you have a credibility that is far more believable for those with autism. That's a talent. And I do seriously look at whether you can mentor other people with autism to follow in your footsteps.
Mm-hmm. It's that whole been there, done that, try this philosophy all over again.
Yeah.
All right, Dr. T, we've come to the end of our questions, and I thank you again for spending time with us and answering these, because clearly you have a profound insight, and we just need to get these messages out from you as quickly as we can. So thank you for doing that.
Thank you, Craig. Delighted.
And thank you, Autism Hangout. We'll be back again with another Ask Dr. Tony session.